Successful telemedicine programs identify key responsibilities and assign them as appropriate. Over the years, certain standard roles have emerged. Depending on the size of the organization, many of these roles may have full or part-time responsibilities. A number of different roles need to be filled, and it is not uncommon for one person to cover more than one role. The remote clinician site is usually a multi-clinician center that provides consultative or screening services to patient sites using telemedicine technologies. Creating and maintaining a skilled remote clinician site team is instrumental in your program implementation and operation. A number of staff roles influence the efficiency and effectiveness of your telemedicine program. Although titles may vary, every program needs to address program management, clinical direction and oversight, clinical services, clinic coordination, and technical support. The size of your program and available staff will determine how these roles are assigned at your organization. Large program sites generally have a program manager that provides overall management and oversight of program activities. The program manager is the leader of the telemedicine team. He or she represents the group, advocates on its behalf to the organization, and manages the staff. The manager reports on the function and progress of the service, directs any process and improvement activities, negotiates budgetary issues, recruits and hires staff, sets priorities in consultation with the team, and supervises its functioning. A medical director will provide clinical direction and oversight to the telemedicine program. He or she acts as the liaison with the organization's medical staff. The medical director helps to provide clinical credibility for the program, represents it to the clinical staff, and recruits providers for the service.
You need that commitment from the top down. It has to be something that's a priority. You need to have a commitment from the administration and the medical staff. Otherwise, it's not going to go anywhere.
The remote clinician is responsible for conducting the actual telehealth visit. It's important for this person to be familiar with the equipment and basic troubleshooting techniques. Typically, a telemedicine coordinator manages the day-to-day clinic operations. The coordinator is responsible for the actual conduct of the telemedicine consultations. He or she develops operational protocols, schedules medical specialists for telemedicine consultations, schedules and verifies the presence of the patients to be seen, ensures that the necessary clinical records information is available for the patient, and verifies that the equipment is functional prior to the beginning of consultations. The telemedicine coordinator assists the specialist as necessary during the consultation and completes any necessary paperwork, including billing forms and communications with referring physicians.
If they can have the position of a telemedicine coordinator, it significantly increases your use and success of a program.
Every telemedicine program should have a person on staff that possesses the technical skills to set up and maintain all telemedicine equipment. This person, typically referred to as a technical specialist, is tasked with ensuring that telecommunications and networking issues are addressed and resolved. The technical specialist should also be available when there are technical difficulties with live examination sessions. It's important to keep other members of your organization's staff apprised of telemedicine program services and activities.
What is the commitment from the administration and from the medical staff to telemedicine, in our case telepsychiatry? If that commitment's not there, then you're wasting your time.
Making sure that you're communicating through the entire process, letting them know about the progress that you're taking, keeping people informed, keeping them involved. The main thing that you want to do is make sure that you have conversations with your leadership first. Getting their buy-in, getting their input, getting their suggestions on where you need to start is always very important.
The Chief Executive Officer and the organization's administrative team should also act as the program's champion, encouraging others to support and utilize your telemedicine program. This group will participate in program development, understanding the impact the service will have on the local provider community and on their own facility. The Director of Nursing participates by estimating the nursing hours required, types of expertise needed, staff training requirements, and whether or not personnel can be shifted from other services or if new hires will be necessary. Training is important in telemedicine programs and will be required for staff at both the patient site and the remote clinician site. Many organizations use existing training personnel to assist with the development of telemedicine training, while other programs may use outside training sources. The trainer identifies who needs to be trained and what they need to learn to confidently perform job-specific activities. In addition, this person assures that new staff are trained and existing staff retrained as necessary. The business office needs to understand the billing processes for telemedicine and how they differ from normal billing practices. For patient sites, the billing is generally limited to the facility fee, but may be more extensive under contractual arrangements where the local facility assumes the billing for services role. The business office usually processes any applications that may be required for telecommunications discount programs.
The passion of the staff is just self-evident, and they're proud and they send success stories about the patient that felt hopeless or felt that there wasn't an option for their care, and they have a telemedicine consultation and they have options. And the staff that take great pride in those moments usually work for organizations that end up being successful with telemedicine.